Good morning, everyone. My name is Falmata Bunu. I will be moderating the event today. Welcome to National Girls in ICT. We're doing a competition across 6 geopolitical zones, and this would be our second one. We've done one in the South, and we are happy to be with all of you today. Welcome. To begin, we will start the national anthem. So I'm going to play from YouTube for us. Feel free to sing along.
O God of creation, direct our noble cause, guide our leaders right, help us the truth to know, in love and honesty to God and
Very sure. Yeah. So starting
This meeting is being recorded.
my also put this screen up. Have I stopped sharing? Get on my screen, Irene. Okay, so to begin, I would like to hand over to my colleague, Mrs. Mariam Lawan, to do the opening remarks. I hope everyone can hear me. On to you, Mariam.
Okay. Okay, thank you very much, Falmata. And hello, innovative young ladies. Good morning to you all. Distinguished guests, innovation hubs, judges, secondary school management, and teachers, good morning to you all. It is an honor to stand before you today to discuss a topic crucial for the progress of our nation: how girls in Nigeria can leverage on digital technologies to innovate solutions for our community challenges, particularly in the areas of education, security, and health. In Nigeria, like in many parts of the world, girls face unique obstacles that hinder their ability to thrive and contribute fully to society. However, we are at a pivotal moment where digital technology can serve as a powerful equalizer, leveling the playing field and amplifying the voices of girls across the world. As we delve into the crucial role of girls leveraging on digital technologies to address community challenges in Nigeria, it is essential to recognize the pivotal efforts of Ministry of Communications, Innovation and Digital Economy under the visionary leadership of Dr. Bosun Tijani, who is passionate and committed to bridging digital gender divide and ensuring reduced inequalities in the tech sector. Let us applaud the efforts of the ministry for their dedication to empowering girls and women in Nigeria's digital landscape. Together, we can build a more inclusive and equitable society where every girl has the opportunity to thrive and contribute to the advancement of our nation. My dear innovative girls, I want you to take a moment to speak directly to you because you are the heart of our future. You possess the strength, resilience, and boundless potential. Today, as we discuss the importance of leveraging digital technology to innovate solutions for our community challenges, I want to remind you of your inherent capacity to drive change. You are not just the beneficiaries of progress, you are the architects of it. Embrace the opportunity that digital technology offers. Use it as a tool to amplify your voices, advocate for your rights, and create solutions that address the pressing issues facing our communities, whether it is in education, security, health, or beyond. I urge you to dream big, work hard, and never underestimate your capacity. The world is waiting for your brilliance, your creativity, and your leadership. Seize the moment, embrace the challenge, and let your light shine bright. Believe in yourself, for the future belongs to those who dare to dream and do. Remember, you are unstoppable. Thank you very much.
Thank you, Mrs. Mariam. That was a very lovely speech. I hope everybody found it as inspiring as I did. To begin, I would like to introduce of the 5 teams of girls across the southwestern states, the first one to do their presentation. From Ekiti State, we have the Dynamos from FSTC Usi Ekiti School, who are being supported by Kimplus Tech Hub. Please introduce yourselves and begin.
Hello, King Plus, are you with us?
Yes, ma'am.
Okay. Please share your screen. Thank you.
Good day, everyone. We are Team Dynamos from Federal Science and Technical College, Ushekiti. My name is Olabiolu Anfemi. I am here with me. Oluwa Prudence. Everyone needs help in an emergency situation. Imagine getting all the help you need as fast as possible in an emergency situation just by pressing a button. The problem of insecurity is now rampant in our country today. Many lives and properties have been put into danger because of this problem. That is why we, Team Dynamos, have come up with the development of a security system called Dynamos Alert System. And our tagline is one button, instant rescue. Now, moving on to our problem statement. 1. Insecurity is a present issue in Nigeria with various threats, including insurgency, robbery, kidnapping, and more. 2. Current emergency response system lack precision in location tracking, leading to delayed or ineffective responses. 3. There is a need for a quick and precise alert system to address this security challenge.
And moving on to our solution. We provide the solution of sending distress signals with precise location details to concerned authorities. With the press of a button, help can be summoned swiftly to the exact location of the emergency. That's aimed to revolutionize emergency response and save life efficiently. Our major key features. DAS can be held personally and installed in various locations such as homes, offices, vehicles, and more. GPS is incorporated in DAS for precise location tracking. We have the SIM card registration for processing and capturing essential user details for identification and contact of the rescue team and relevant family and friends.
Now, moving on to our marketing strategy. Dynamos Alert System can effectively penetrate the market established itself as a trusted leader in emergency response solutions and adoption among target customers. It forged partnership with the governmental bodies, the security agencies, and relevant organizations to gain credibility, access to resources, and facilitate widespread adoption of DAS. DAS also provide comprehensive training program and ongoing support to users and administrators to ensuring smooth implementation and utilization of the system capacity. Lastly, DAS continuously gather feedback from customers and stakeholders to identify areas for improvement of this innovation. So our roadmap, for the first to the third month of producing this device, we'll use it for the development and the testing. And now from the third to the sixth month, it will be used for the initial launch and market penetration. And from the sixth to the 12th month, we'll use this period for expansion of and growth of our product. And lastly, after the expansion and growth, the optimization and continuous improvement of the product will take place.
Our future possibilities. We regularly update software to enhance efficiency and reduce the cost. We aim to make DAS accessible to all, contributing to nationwide security improvements. We will explore opportunities to integrate DAS with Internet of Things devices and platforms, allowing for automated alerts, remote monitoring, and proactive risk mitigation in various environments such as smart homes, vehicles, and public places.
Now, moving on to the materials used for DAS. Firstly, we have the Arduino Nano. This is a small versatile microcontroller board based on the ATmega 328P chip. It serves as the brain of the DAS, controlling its various functions and processes. Then, the GPS Neo 6M module is a GPS receiver module that provides accurate positioning data by receiving signals from GPS satellites. It allows the DAS to determine its precise location coordinates. Now I want to show you how our device works. Immediately the user press the button, a message is sent to the concerned body. Then the concerned body click on the link on the message, then clicks on open URL, which will show the precise location of the user and also the precise location of the device. And it will also show the longitude and latitude of the current location. As you can see, we are currently in Federal Science and Technical College, Ishekiti. Now, the conclusion. Team Dynamos wishes to encourage the good people of Nigeria to make use of Dynamos alert system to reduce the rate of insecurity in our country and to save life faster with less stress. Now, Dynamos alert system. Our tagline is one button,
Instant rescue.
Thank you for listening.
Thank you very much, Team Dynamo. That was a very impressive presentation. We already feel like we're on to escape Nigeria. I would like to pass on to our esteemed judges if you have any questions for this team.
Hi, girls. Well done, well done. My name is Dr. Mayko. I'm really pleased to be here today. Well done for your presentation.
Thank you, ma'am.
One button.
Instant rescue. Instant rescue.
Very impressive. So, the only thing I would say is it would have been nice to have your demonstration on your presentation. It would have helped us see how that would really play out to have to operate, use your application. but I think it's an application that is well needed because at the end of the day, it's, lives need to be saved. We do have some of these things, applications on our phones, but not as much as what you have put together and considering the problems that people are facing. So well done, well done, well done.
Thank you, ma'am.
Very quickly, good morning and well done. Very detailed presentation. I really enjoyed it. Dr. May has covered most of what should be said. I'd just like to ask, have you ever thought about monetizing this idea? And if yes, how do you think you're going to do that? Just run me through that very quickly, 30, 45 seconds.
Sorry, sir, we didn't hear you.
Have you thought about how you could monetize this idea? Have you thought about that? Did you think about how
Yes,
you
sir.
make money? Yeah, so just quickly run me through your monetization plans. Just 30 seconds.
Okay, sir.
Want you guys to hear. You hear what they said? They did not talk about how they can monetize the idea, they just okay, so you can learn something from the first when you are taught.
As I said earlier about the marketing strategy, the Dynamos alert system will forge partnership with governmental bodies like the security agents who allow them to know about our products, which can help them in rescuing people quickly, people who are in danger. And we also launch targeted marketing campaigns to create awareness and make people know that there is a device that can help them in danger situations and that will help them get rescue very faster because it will help them locate their current, it will help them get the current location of the people that need help.
Okay, awesome. So just for future versions, when you're working on it, think about things like charging the government a subscription fee for using the platform. You could also do things like an emergency fee for the private individuals who want to also use the platform. What the plans you've made with marketing are awesome. Just think about other ways you could monetize it. A subscription method
Okay.
is definitely
Okay.
a way to go.
Thank you, sir. That will definitely be done.
No problem. Well done.
Thank you, judges. Thank you, Team Dynamos, for a great presentation. We will be moving on to the next group from Ogun State, OHS Girls Techies from Owede High School. The volunteer hub is 720 Degrees Innovation Hub. We welcome you and you have the floor. OHS girls.
Hello, can you please allow us to share our screen?
Okay, we will do that. Thank you.
Good day, everyone. My name is Olaudin Tessin, one of the team members from OHS Girls Techies. We are providing sustainable solutions to the healthcare sector in Nigeria through TRAM. TRAM, Transforming Healthcare Access and Management, your comprehensive health company. What are the problems facing the healthcare services in Nigeria? According to World Bank, Nigeria has approximately 0.5 hospital beds per 1,000 people. significantly below the global average. Here are the problems facing the healthcare sector in Nigeria. Limited access to healthcare, limited health education and awareness, difficulty in managing medications, limited accessibility to health facilities, inefficient healthcare system, shortage of healthcare professionals. Access to healthcare services remains a persistent challenge, influenced by factors such as geographical barriers. Moreover, there are few unified platforms that integrate essential services such as telemedicine consultations, medical records, and symptoms diagnosis, symptoms checker, diagnosis consultations. Introducing TRAM. TRAM is an AI-enabled mobile app designed to address the gaps in healthcare access and management by providing a range of essential features. Here are the features: reliable health information, health records, telemedicine, medication management, emergency services, location-based services. Market validation. According to Tech Kaba, $7.88 million funding was raised by healthcare startups in Nigeria to date. 75 active Nigeria tech startups, $2.1 million raised by electronic medical record startups. 31% of Nigeria healthcare startups offer telemedicine services. Market size. Nigeria connected healthcare market in $1 million. Market is forecast to grow at a CAGR of 29.4%. CAGR means cumulative assets growth rate. As of 2022, the market value was $59.72 million. By 2030, the market value will be $469.49 million. Thanks.
Thank you very much. Here is how you access TRAM. Firstly, you create an account on the mobile app. You sign in into the account, that you'll be introduced to the first interface, which contains our essential features. Let's take telemedicine as an example. Click on telemedicine. View available doctors. Click on available doctors for your consultation. The consultation for the first time is free. The doctor prescribes medication and gives the link to download the file. We have listed pharmaceutical stores on the app. You can purchase the drug from the listed pharmaceutical stores. Business model. This is our estimated revenue for TRAM. TRAM will generate sustainable revenue stream while providing valuable health and wellness services to its user. The combination of subscription-based revenue, in-app purchases, partnership, data monetization, premium services, and corporate wellness program position TRAM for long-term success and growth in the competitive healthcare technology markets. We have for subscription model, we have 105 million naira. For in-app purchases, we have 15 million naira. For partnership, the estimated revenue is 75 million naira. And for corporate wellness program, we have 90 million naira. Cost structure. Here are the cost structure, which is the breakdown of all the expenses held by TRAM in its operation. It is segmented into technology expenses, operational expenses, and promotion. And the estimated total is the target market. Who are the people that TRAM focuses on? TRAM aims to reach a wide audience of individuals, organizations, and healthcare stakeholders, seeking innovative and accessible solutions for managing their health and well-being. TRAM focuses on 10% professionals and companies, 20% caregivers, and 70% individuals seeking convenient and accessible healthcare solutions.
Thank you very much. TRAM launch plan. We have market research, followed by app UI or UI development. Next is app development, app testing. We have app deployment and post-launch support. Market strategy.
social media marketing, app store optimization, content marketing, partnerships with medical professionals and providers, and healthcare forums. Tram roadmap. Phase 1. Tram roadmap. Phase 1. The duration is 1 month. Research and planning. Phase 2. UI or UX design. The duration is 2 months. Phase 3. App development. Duration is 4 months. Phase 4. Testing and iteration. The duration is 2 months. And phase 5. Deployment and launch. Duration is 1 month. Market competition. Thank you very much. We have 4 market competition. Doctors 24/7 is a telemedicine platform that enable Doctor 247 is a telemedicine platform that enables everyone to speak with a doctor about lifestyle management, human sexual and reproductive health, and generally, I hope free medicine, drug healthcare Nigeria. Tram advantages. One of the step solution for all their healthcare needs eliminates the needs for multiple apps and services using AI. Tram provides tailoring health advantage, use AI, advanced use satisfaction and outcome. Tram provides users with access to a comprehensive database of reliant health information prioritized by healthcare professionals. Tram facilitates visual consultation with healthcare professionals, allow users to seek management advice and guidelines. Financials. We are seeking a 12-month financial plan to initiate the launch of Tram, offering 12% equity in returns. We believe that Tram will solve the issue in the health challenges of Nigeria. Thank you. Thank you very much.
All right. Thank you very much. To OHS Girls Techies, thank you for a very comprehensive presentation. I would like to pass on to the judges. Any questions or comments you might have? Thank you.
Doctor, are you going first?
Yeah, thank you.
Okay.
Well done, girls. Well done, girls. I really enjoy your presentation. Before I comment, just for comment on the things I liked about your presentation. First, I like the use of data, and I like that your presentation was pretty, really lovely. The use of color, and also the fact that you have a business model and a plan to carry out to see that this comes into fruition. But my question is, how much would it cost an individual to subscribe to this app? How much would it cost an individual to subscribe to this app? I know you've mentioned that if you're going to generate 105 million naira from individuals, so how much would one individual pay? And I recognize that you said that it's going to be free on the first consultation, but how much would it cost one individual? I was waiting to hear that.
10,000 per month.
10,000
for individuals, 10,000.
Okay, and I want you to think about who the people who are going to users and how affordable it would be for them and how accessible it would be for them, because most people would tend to use healthcare, cheap, affordable healthcare. People who cannot afford certain things like phones that have this kind of apps. So think about that. Another thing is, in your presentation, I would like you to next time use faces that Nigerians recognize. There are a lot of Nigerian doctors out there. You can, they're black looking, models you could have used for your research, so that it's not just, I don't have anything against whites, white race. It's just that this focus on Nigeria and we should use, black people to represent this. Above, I think that the presentation was wonderful. And also in terms of your presentation, next time, try to be a lot more, would I say, allow it flow a bit more so that you're moving swiftly from one person to the other. And don't worry, you've done an amazing job, so don't be nervous next time, okay? Well done. Thank you so much. Over to the next judge.
Thank you, Mom.
Yes, well done, 720 degree hub. Your presentation was quite amazing. I just want to give you some sort of advice with regards to 2 slides. So the very first one is your ask when you said you were looking for something 12-month financial plan. You probably want to look back at that, I'm not sure that's what you mean. You're probably either looking for a 12-month runway, or you're looking for amount of money, or you're looking for advice or mentorship or industry connections. So you want to be very, very clear what your ask is. You can go back and correct that. Then whenever there's an ask, you want to tell the investor or stakeholder or partner what you're using that ask for. So it could be, if you're asking for money, what are you using the money for? If it's a runway, how long is the runway? Of course, runway to is money. Then I also noticed, I liked how you highlighted your competition, but I'm not very sure that your competitive advantages were the strongest that you could use. So just in case for the future, when you're talking about your competitive advantage, you want to play around cost. Are you cheaper? Is it more convenient to use your solution? Is it faster to use your solution? Is it more efficient? So you want to build your USPs around what is relatable to your audience or the market who you're selling to. The fact that you're using AI is a competitive advantage, but how does it affect me as a user? So it could be that your solution is more efficient, or that is broader, or that it is cheaper, so use these elements that are relatable, okay? But all in all, great presentation, awesome job, kudos.
Thank you very much, sir.
Thank you, OHS Girls Tech Cruise, for a wonderful presentation and for all the different faces we saw. Thank you, Dr. May, Mr. Namdi. We will be moving on now to the next group from Ondo, the Brigaders team. They're hailing from the Federal Government's College, Akure, and they are sponsored by Growth Hub. So we will move on to them now. Growth Hub, I think you need to reset your sound. There's a rigging sound in your, okay, that's better. So, ready when you are.
Good morning, everyone. My name is Adibara Baraka from Federal Government Girls College, Akure. And we are
Excuse me, Bike Brigaders. I think there's an issue with your sound. So if you could take a moment to rectify that. It's hard to hear you.
Good morning, everyone. My name is Adibara Barakat from Federal Government Girls College, Akure. And with me here they are the members of the Bike Brigaders team. Before I proceed, I would like to give a brief story on how we came up with the school health record idea. On a fateful morning, a girl walked up to me with menstrual cramps, and it took me about 10 minutes to take her to the clinic, 10 minutes to search for her card, and additional 10 minutes for the girl to be attended to that clinic because of the long queue present in the clinic. I was disheartened by the situation that occurred that morning because it had interactions with my lecturers, and I thought about possible solutions to the problem, which yielded negative results. But luckily for we, the Federal Ministry of Communication and Digital Economy proposed an opportunity for young girls in ICT to tender their problems and solutions about a particular issue. So all my team members were very happy on hearing this because we knew it is a platform for us to express our grievances. Thus, that led to the creation of the School Health Record website. During the course of our investigation, the main problems we discovered were: one, laziness of students of going to the clinic; two, the use of manual health database, which is vulnerable to attack. For example, a student might have a headache and she feels like whenever she gets to the clinic, it will be a very long process for her to look for her card, and also a long process for the clinic women to attend to her, because imagine having to search through about 2,000 cards just to pick out one. That should be a very, 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 very strenuous and tedious process. So during the course of our investigation, the main problems we discovered were laziness of students going to the clinic, and also the use of manual database, which is vulnerable to attack, and also the long delayed process in giving medical attention to the students. So my other team member would love to talk about the mission and the target market. Our mission is to reach out and also reach out
Excuse me, please speak up or put your volume up. We can hardly hear you.
Our mission is to reach out 124,000 students for adoption, and also reach out to 104 federal colleges with the help of
Hello. Sorry to interrupt again. Please ensure that your microphone is not covered up. We can barely hear you.
Our mission is to reach out 124,000 students for adoption, and also reach out to 104 federal unity colleges with the help of Federal Ministry of Education to help us make our product available to all federal. To help us make our product available to all federal universities. With the help of Federal Ministry of Education to help us make our products available to all federal universities. This is to be able to promote holistic well-being among students by addressing the health issues. Through proactive initiative and partnership, we strive to create a very supportive environment which has mental, physical, and emotional well-being for students. Our target market is to reach out to the educational professionals, the parents, and federal Ministry of Education and Health to help support us by prioritizing the well-being of students and implementing the interventions. We are committed to creating a more healthier environment. Together, we can make impact and differences
types of students of federal university colleges?
Our solution to the problem is to create a website for tracking health records instead of relying on cards or cards. It also reduces time needed for a student to gain medical attention in this setting. Also, it will help our health officials to keep track of what to apply in order to know when they need to stop. Our impact, it will save life, it will foster easy access to student health records. It will reduce the reduction of long text manual files. It will increase the interest of students in technology.
Our project will create a platform for nurses to have an easy access. Our project will create a platform for nurses and the school management to have an easy access to a student health record. And also, at the beginning of the implementation of this policy and this project, the old manual database will be embedded into the computer system. So the nurses and the school management can also have a full view of a student's health record, which will contain the vital information of a student's health record, like allergy, blood, the weight, the name of the student, and so on. And also, this opportunity and this implementation can also be limited to the new students and the new intakes. That is, whenever we are getting new students, like in SS1 or GS1, they can just easily have access to the school health record website. And also, the revenue model of our project is to reach out to the Federal Ministry of Education and also the Federal Ministry of Health to pay a sum of 5 million naira annually in order to access and in order to make the school health record website available for all the 104 unity colleges here present in Nigeria, and also to reach out to the parents and guardians to pay a sum of 200 naira per term, which will be a total of 600 naira per session, termed as other levy, in order to access the school health record website.
If all the above mentioned are considered, it will go a long way to help the government in policy formulation and also to help the government in implementation in terms of challenges or in terms of health issues. To also help the dedicated consultants in carrying out researches on various challenges confronting students of federal unity colleges, not only in Ondo State, but across the federation, which may by extension be a profile solution to health issues in non-federal unity schools. We should also note that this is not just a competition, but a problem we should build on. Thank
you. Thank you.
So here's the video of the way we can actually go to the website like Google Chrome to search for the website. That is on the video. You have the Google website, then you type in the idea, which is dev.eduhealth.pantheon site. Then typing on the address is going to take you to the home page. Then when you get to the home page, you have the two boxes for the username and also the password. Then you enter it and log in. After logging in, you get to the record page. On getting to the record page, the number of the address of students, the information of all students are already on the record page. So to make it easier, you just tap on the search box and search for a particular student's name. Then typing on the name, it will bring out the suggestions of students that get that particular name. When you tap on the name, then when it's necessary for you to update the record of such student, you tap on update record, and coming to the clinic, the consultation, the person is coming for, and also the prescription and the nurse on duty. So when you fill all this and you submit it, that means you've updated the record. Thank you.
Thank you. There's I would like to take a moment, please. If you are not speaking, I would kindly ask you to mute your devices. That being said, thank you very much, Bright Brigaders, for a very lively presentation. I would like to hand over to our judges for any questions, comments.
Okay, so I think it's more like a comment towards the end of your presentation. First and foremost, awesome. I really like your presentation. I like the design and outlay of the deck with which you use in presenting. But towards the end, I think you did say something about this is a video. You wanted us to see how it worked, but we didn't get to see the video. Am I correct? Or did I hear wrongly? You're muted, so I can't hear your response. If there's no video, it's fine. I just wanted to be sure that I didn't hear.
I want to play the video now. So here is the video, and this is the Google Chrome. So on getting to the Google Chrome, that is the you search on the address. That's web.eduel.pantheonsite.eo, and this is the home page. On getting to the home page, you have two boxes, which is the username and the password box. Then you fill it. After filling it, you log in, and this is the record page. When you get to the record page, all the informations of the students are there. But to make it easier, there's a search box up. So you type in the name of the student you want to attend to. Then on typing the name, to bring out the suggestions of students that bear that particular name. So you tap on it and you click on update record. When you click on update record, you have the name, complaint, description, and the nurse on duty. Then you fill in the logs and you submit. Submitting means you're updating it. And when you update it, the school management and the nurses also have access to it. Thank you.
Great, awesome. Really nice presentation. Well done.
Dr. May, any comments or questions?
No comment. But well done, girls. Well done on the lovely presentation.
Okay, thank you, Bright Brigaders, for a great presentation and for an interesting video. We would move on to Carago from the Muslim Comprehensive High School from Oshun. They are supported by Apollo Global Hub. So you have the floor.
All right,
Team
thank you.
Carago?
Yes, they are up their device currently. I think they asked the network threw them out. So please bear with us.
Would you like a few moments? I think we can move on to the next group before you sort that out.
Please, kindly move on to the next, please. Thank you. So
Okay.
try to.
Next, we have the diverse elites from Oyo State. They are part of the Livingston College of Arts and Science. They are supported by Blockchain Innovation Hub. If you're with us, you have the floor. Diverse elites. Hello, diverse elites from Oyo State. Are you ready?
Oh, it's like this. Okay. Now the slide. The slide. Okay. Okay. Good afternoon, everyone. We are ready, ma.
You have the floor. Welcome.
My eyes. Okay. Okay. Good afternoon, everyone. We are the diverse elites from Livingston College of Arts and Science, Ibadan. My name is Precious Ojo, and I'm the team leader.
My name is Oya George. I'm the project researcher.
My name is Adajo Gates, and I'm the app developer.
So we're here to do the pitch of our technology-based solutions to quality education, which is part of the Sustainable Goal Development, SDG 4. Who are we? We're a passionate group of 3 young girls with diverse backgrounds, united by a common goal to make a difference. Now, imagine a classroom buzzing with excitement, not just about the subject matter, but the opportunity to learn. Every student, regardless of their financial situation or background, has the opportunity, has the access to education. From textbooks to notebooks to study guides and reviews, every student has the opportunity to learn. This is not just a dream. This is the vision driving the Scholars Hub, a groundbreaking mobile app designed to democratize education. We believe that every student has the chance to unlock their full potential, and having access to these basic educational materials is a critical piece of this puzzle. But the reality is that many students face a harsh choice. One, to burden their family with high cost of textbooks, or to sacrifice these valuable educational materials. So at Scholars Hub, we plan to bridge this gap. Here is how we plan to do this. What are our core functionalities? 1, textbook exchange. We connect students with gently used textbooks to other students who might not be able to afford them. 2, resource hub. We share other learning materials like notebooks, calculators, study guides, promoting reuse and reducing waste to the minimum. 3, community forum. We connect learners to discuss academic topics, exchange tips, and support each other's educational journey. So what is our purpose? Why are we here? Why did we create this app? 1, promote equity and accessibility. So we plan to bridge the gap between students who have surplus resources and those who need them. This will ensure that every student has equal access to quality learning materials. 2, encourage affordability. We plan to provide cost-effective alternatives to purchasing new textbooks and supplies, making education accessible for all, regardless of your financial situation or where you are. 3, support sustainability. So we plan to foster a culture of reuse and responsible resource management within the educational community. Now, what our visions are? Mission and vision. The Scholars Hub app aims to connect learners and empower education by fostering a collaborative and sustainable environment for sharing educational resources. Our vision is, we envision a world where every student has equal access to resources they need to succeed, regardless of their background or financial situation. At Scholars Hub, we strive to be a leading platform that promotes educational equality, affordability, and environmental responsibility.
What are the potential positive effects for the students? It helps to increase access to educational resources for those who cannot afford them by giving them contact with free and low cost textbooks and resources from those who have it, who can donate to others who do not have. Secondly, it helps to reduce financial burden. Students who cannot afford textbook might not be able to focus on their studies properly. This is where Scholars Hub comes in. It helps to connect students with textbooks they cannot afford, which helps them to focus on their studies and not on the textbook costs. It helps to promote sustainability. Scholar Hub app helps to reduce waste and by the reuse and sharing of resources, and helps to improve the environment in the educational sector. It also strengthens community. The app helps to foster a sense of community among students by creating a platform for collaboration and resource sharing. Our border community. It reduces educational inequality. Every student in the country has a shot at success with equal access to resources like textbook and other materials. It promotes environmental responsibility. It helps us to reduce waste, which also keeps waste materials that are being thrown away that could be used by other students to reduce waste in the environment. It empowers students. It empowers students to become active participants in sustaining a learning environment. And our additional benefits, it reduces demand for new textbooks. This could potentially lead to lower textbook prices and benefits the broader educational community. It increases awareness of resource sharing. The app raises awareness about the importance of resource sharing to other students and promotes a more collaborative approach to education. It inspires inspiration. It inspires other initiatives. The success of this Scholars Hub could inspire similar initiatives in other communities, leading to a wider impact on educational equity and sustainability. Our target audience.
So this is our target audience. The students in our primary goal, students in secondary school who need affordable access to textbook and other learning materials. In our secondary goal, students who have gently used materials to donate. Also, the educators are part of our target audience. Teachers and professors seeking affordable resources for their students can go to Scholar Hub and get it for them. Also, educational institutions interested in promoting sustainability and resource sharing can go to the same Scholar Hub for their students. Additionally, the Scholar Hub can appeal to individuals and organizations who share the app's value and want to contribute to creating a more equitable and sustainable educational landscape. Our innovative proposition focus on students. Our targets are the private and the public school students for addressing the necessary textbook needs. More than textbooks. The Scholar Hub is more than textbooks. We share notebooks, calculator, and study guide, and for every student's need. Scholar Hub, we don't share only textbook, we share notebooks, calculators, and study guides for every student that need them. Community Hub, our Scholar Hub doesn't only connect donors, we foster a forum for academic chats, supporting each other, sustainability future. We reduce waste, we use resources, we okay. Okay. Next, please.
So now, what was our mobile app roadmap? First, our phase one was research. We did extensive research on our app and how it will benefit the community. What was the phase two? Our phase two was market surveys. So around our areas, we went to different public schools to analyze the need for textbooks. So we interviewed some students, asking them whether they had some textbooks, and most of them had a negative answer. Most of them needed textbooks and said that their family could not afford them. So we then went to our phase three, prototyping using Canva. So we did a prototype of how we want our app to look like, as you've seen on the previous screens. Then phase four, we then went further to develop our app using the Codler app inventor. So we've done a short development of the Scholars Hub app. Then now, what are our future projections? Mobile app enhancement. So we continuously plan to improve the mobile app based on the users' feedback. We want to add new features and functionalities to enhance the user's experience. New technology. So we plan to explore integrating new technologies like chatbots or AI-powered search filter so that students can access resources that are closer to their location. Now, our app monetization. So we plan to partner with sponsors and organizations that could sponsor our app. So we plan to run advertisements of this sponsorship on the ads to generate income. So we also plan to look for grants and donations from, example, the Federal Ministry of Education. They focus on sustainability. Our app focuses majorly on sustainability, reusing and reducing of waste. But we want you to remember that the core mission of the Scholars Hub will remain focused on affordability and sustainability. We aim for student success. Any monetization strategy will be implemented ethically and transparently. Thank you very much. Hope you enjoyed our pitch deck.
Thank you very much, Diverse Elites. That was a very good presentation, and you are welcome. I know I definitely would have liked to have that when I was younger. Well, passing on to the judges, if you have any questions or comments, you have the floor.
Hi, Diverse Elite team. Well done, well done, well done. This is such a unique application. Like the other speaker said, I would have loved to have this when I was younger, because sometimes there's all this requirement for textbooks and many people could not afford them. So this really touches so many things. I love that it touches environmental sustainability and it addresses waste and education at the same time. I think this is fantastic. That's what I have to say now. I know it's not perfect, but really and truly, from an idea viewpoint, I think it's excellent, and I hope that you take this really forward and impact a whole lot of people, especially those who are unable to afford their textbooks and like so many other applications that is really useful for education. So well done on that. I like your method of presentation. I love your enthusiasm, and I like your background. Fantastic, lovely. I want to see you grow up to be even do more. And I love that you have looked around your colleagues to find new solutions for them. Well done, well done, well done.
Thank you, ma'am.
Mr. Namdi, do you have any comments or questions?
No. I think Dr. May has literally covered it. Anything I just say now would be too much. She literally covered everything I should say. Amazing presentation.
Thank you
very much, sir.
again. Thank you, Diverse Elites. We will move on to Team Mama 360 from Lagos State. They hail from Ogombo Community Junior Secondary School, supported by Eco Innovation Center. Welcome, you have the floor. Team Mama 360. Elite, please stop sharing your screen, and anyone who is not speaking, please mute. Thank you.
Good day, distinguished guests and judges. My name is Edith Comfort. I'm the project lead. With me here.
Elite, please, Diverse Elite team, please stop your screen sharing.
Please, can you enable the screen sharing?
Thank you. We'll do that just in a moment.
Okay.
We can see your screen. Please begin.
Good day, distinguished guests and judges. My name is Edith Comfort. I'm the project lead. With me here.
My name is Rachel John. I'm the Finance and Marketing Officer.
My name is Gabriel Sonoide. I am the project analyst. They are the students of Ogombo Community Junior Secondary School. They are the team of Mama 360. We are here to discuss about maternal mortality. Maternal mortality is the death of a mother due to complication from pregnancy to or childbirth. Did you know that Nigeria has one of the highest maternal mortality rates in the world, with a significant number of those deaths occurring in Lagos? We are the team of passionate young women who believe that technology can turn the statistic around and save the life of mothers across Nigeria. Our tagline is saving pregnant women in Lagos and across Nigeria.
Our core SDG is SDG3, which is good health and well-being. Our solutions to solve mothers' SDGs, like SDGs 1, 4, 5, 8, 10, and 17. My colleague Jeremy has a personal experience to share. Rachel, please, can you share your personal experience?
Mrs. Adeshina, my mother's best friend, died during pregnancy because instead of her visiting health center, she was busy buying local medicine from local medicine men like Agbo Jedi, Agbo Shere, Agbo Rafia, Agbo for this substance do not have medical precision and dosage.
As you can see, that Rachel is pain, and we are all pain. As you can see, that Rachel's mother's friend died recently, and she's representing the thousands of women that are dying yearly. According to the World Health Organization report, 830 pregnant women die every day in the world. 50,000 pregnant women die every year in Nigeria. Nigerian women face the risk of losing their life to complications related to childbirth, pregnancy, and drug abuse. Factors like lack of access to quality health care, insufficient prenatal care, and shortage of skilled birth attendants. Lagos State has over 21 million population. According to the Nigeria Bureau of Statistics 2022, 555 pregnant women die every 100,000 births.
To address this, we have developed a tech solution called Mama 360 that will target pregnant women in Lagos State and Nigeria. A mobile app designed specifically to reduce maternal mortality in Lagos and beyond. Our solution connects expectant mother with essential prenatal and postnatal care service, provide them with vital health information, health education. Just like Nelson Mandela said, education is the most powerful weapon with which you can change the world. Our solution will also ensure pregnant women to get quick help in emergency. How do Mama 360 work? You first of all download our mobile app. After download, you create an account. After create, you can now log in. But if you forget your password, there will be a sign-up page that says forget password. You click on it and it will take you through some process to log in again. Pregnant women can also have access to pregnancy calculator, access to health center, access to health care, access to blood bank from blood donation. Donors and sponsors can also create an account with us and have access to funds or support our project. You have not seen anything yet. Let's show you what to stand out for.
What makes our solution unique is its accessibility and focus on community engagement. Mama 360 is not just an app, it's a lifeline. It utilizes AI to offer personalized outreach. It managed for medical appointment and direct links to emergency obstetric care. Furthermore, it's designed to work in low connectivity area and ensure that every mother, no matter where she lives, has access to life-safe information. When we visit our big time innovation called Mama 360 Medical, America will serve as super transport to healthcare centers. Our America is a local map that will direct drivers to location of need. Our America will also create job opportunities. We will also integrate the obstetrics medical service data, real-time technology, and incorporating local languages for mothers that now have internet and smartphones. We will develop the ESS technology to allow users to have access to my 360 service by dialing a specific code. For example, star 123 and communicate on mobile phone in a two-way communication of information, making it ideal for interactive service. They build the local language in our platform, like Yoruba, Hausa, and Igbo. It's accessible, affordable, timely, and responsive. Whatever they need to know about pregnancy, are spoken in their own local languages.
By focusing initially on Lagos, we aim to reduce maternal death by 40% in the first year of implementing Mama 360 by creating a model that can be replicated across our country. Our Our impact goes beyond stages like we empower mother, fostering their family, and building stronger communities. One innovative impact about Mama 360 is that it can reach every pregnant woman wherever they are in Nigeria.
Our approach involves collaborating with health center providers, government agencies to ensure a wide-reaching impact.
In Nigeria, becoming a mother should not be a life or death experience. With Mama 360, we have opportunities to change this narrative and ensure that every mother has a chance to see her child grow.
Our market side, Mama 360 will be targeting 1 million pregnant women in low-income and underrepresented communities to validate whether pregnant women will want to use Mama 360. We carry out survey on 150 pregnant women, and over 80% said they will use Mama 360.
We are also for the sum of 3 million naira to help develop our mobile app, carry out program, pay salary and wages and other more. We make money through downloads, donation, grants, sponsor, so that their solution can be sustainable.
Ladies and gentlemen, I and my team stand for it today. Do not see us as children, but see us as young innovators who has come to save life. Maternal mortality is not a joke. Because the government has provided quality healthcare centers, for lack of information and awareness, it's killing pregnant women in low-income communities. I therefore call on you all to support us in this journey by using technology to stop death. The time is now, not tomorrow. And yes, we can do it. Join us to fight maternal mortality today. Thank you.
Thank you very much, Team Mama 360. With your great app, Gator presenting a solution for maternal mortality, I'm sure mothers everywhere will be proud to know that our children are looking for solutions to these problems. I will pass on to the judges if they have any comments or questions for you now.
I think it's just a comment. I really, really want to commend you for an amazing presentation. I loved your slides. I love that there is a screen behind you, and it's also very evident, that you practiced your pitch because you were not reading the slides. You were one with your slide. Amazing presentation. I would definitely sign my mom, my sisters, and neighbors up on Team Mama 360. Well done, guys. Amazing work. Well done.
On to you, Dr. May.
I haven't got so much to say, but to say that it's an amazing presentation, and this presentation is well in there. I love the fact that it is amazing data, which is really real. So well done, well done, well done. Well done.
All right. Thank you. Thank you very much, judges. Now our final team from Oshun. I hope you guys are ready now. Carago team from the Muslim Comprehensive High School, supported by Apollo Global Hub. You have the floor.
Do you know that 70% of people living in the rural environment wouldn't have died if there is enough medical facilities and professionals? Do you know that Nigeria rural population for 2022 was 101,705,566? My name is Kaide Victoria Yemide. I'm the team lead for Carago, and my team members are
Ahmed Rukla, the product designer. Product marketer. Digital Blessing, product distributor.
So we are here. We are preaching on how to revolutionize the way individual. We are here on how to revolutionize the way individuals get access to healthcare. That is bridging gap. That is bridging gap in healthcare access. What is telemedicine platform? Telemedicine platform is the use of electronic information and communication technology to have access and provide support for people when distance separates them. We have telemedicine platform. People that telemedicine platform in Nigeria. We have the doctoral health, mobile health, international cancer health, and so on. This our platform is a mobile app. It is built on Android phone, and because the reason why we build it on Android phone is that the offline functionalities we are performing might not be available on the web. So we are using their mobile app. We welcome you all to the future of in rural settlements. Access to healthcare is often limited by long distance to medical facilities and a shortage of healthcare providers. Residents face challenges in accessing timely medical care, leading to delayed diagnosis, higher health costs, and increased healthcare disparities. That is, we have limited solution. We have remote consultation. This platform enable patients to consult with healthcare providers remotely, eliminating the need for in-person visits. This is particularly beneficial for individuals who are in rural or remote areas with limited access to healthcare facilities. That is, this platform will help remote consultation, time-to-time consultation with the patients and the professionals will be available. Continuity of care. It supports continuity of care by enabling follow-up consultation and monitoring of chronic condition remotely. That is, the platform we are building up will help the continuity of care for people that are dying in healthcare issues. And this platform supports follow-up consultation and monitoring of the chronic condition remotely by the professionals. We have solution 3, increased availability. By connecting patients by healthcare professionals remotely, virtually, this platform extends the availability of medical service beyond mere consultation and traditional office hours. Patients can access care when they need it, reducing delay in diagnosis and operations. We have increased availability. That is, the platform increased availability by connecting patients with the professionals remotely and virtually without any delay in diagnosis on the platform with the patients and the professionals. These are target markets. The target of this platform is on the South community, who does not really have access to healthcare facilities, and this includes the other people. That is, the reason why we are building up this platform is to target the underserved community, those who are in rural areas that does not have access to medical facilities, including the older people that cannot cross from their community to another to get treated. We have benefits, improve access in healthcare service. In rural environments, the platform helps to improve access to healthcare service. In rural environments, where access to healthcare facilities is limited, the offline functionalities of our telemedicine platform ensure that individuals can still have access to low connectivity. That is, this our platform improve access to healthcare service when there is even low connectivity in such area or community. These are platform help to improve healthcare service in rural environments where access to healthcare facilities is limited. That is, this cargo health platform help rural area environments to have access to healthcare facilities when there is limited or insufficient medical facilities in those communities. We have benefits to empowerment through health education. The health tips notification provided by a platform offer valuable educational content to rural communities, empowering individuals with knowledge about preventing care, chronic disease management, and healthy lifestyle choices. That is, empowerment through health education. This platform gives health tips notification and valuable educational content to rural communities, empowering them individually and with knowledge and preventive care they need to know about health. We have benefit 3, cost-effective healthcare solution. Our telemedicine platform offers a cost-effective alternative to traditional healthcare service for rural residents. That is, there will be no cost for joining this platform or registering on this platform. This telemedicine platform offers a cost-effective alternative to traditional healthcare service for rural residents by eliminating the need to travel a long distance before they can get treated. That is, by crossing over from one community to another to get the health facilities that they need. And it also reduces in-person appointments. Individuals can save on transportation costs and minimize time away from work or other commitments. It helps to save transportation costs and minimize the way individual minimize time away from work or other commitments. We have feature upgrade. AI-powered diagnostic assistance. Leveraging the power of artificial intelligence, our platform will offer diagnostic assistance to healthcare providers during remote consultation by analyzing patient symptoms, medical history, and diagnostic test results. AI algorithm can provide real-time support and recommendations. That is, through the assistance of artificial intelligence, our platform will offer diagnostic assistance, whereby the technology will be talking and acting as a woman to ask the patient that how are you feeling, what symptoms are you going through, and tell the patient the treatment needed to be offered. We also have smart health monitoring, integrating AI technologies with wearable devices and IoT sensors. Our platform will enable smart health monitoring capability. That is, through these artificial intelligence technologies with wearable devices that you can wear, and the connection of this Internet of Things, IoT sensors, with our technology or platform. Our platform will enable smart health monitoring capability. AI, artificial intelligence algorithm, can analyze real-time health data stream, detect anomalies or trend indicative of health issues, and provide timely alert to both the patients and the healthcare providers. That is, the patients will be alerted timely, time to time, and also the healthcare providers, that is, the healthcare practitioners. By incorporating AI capability into our telemedicine platform, we are redefining the future of healthcare delivery, making it more intelligent, personalized, and effective than ever before. That is, by incorporating these artificial intelligence capabilities into our telemedicine, Carago Health telemedicine platform, we are redefining the future of healthcare delivery, making it more intelligent, personalized, and working than ever before. We also have the innovative proposition. By combining offline functionalities with proactive health tip notification, our telemedicine platform goes beyond mere consultation service. We empower users to take control of their health anytime, anywhere, fostering a proactive approach to wellness access to medical services, even in area of low connectivity or environment. We urge you all to join us in revolutionizing healthcare delivery and empowering individuals to lead a better and healthier life. By combining these offline functionalities, this our platform is combining offline functionalities with proactive health tips, that is giving notification on health tips. Our telemedicine platform goes beyond mere consultation service. We urge you all to revolutionize healthcare, that is improve healthcare delivery and empowering individuals to live a better life. Our team, Kayode Victoria, team lead, Gani Shakirat. Thank you.
Ahmed Rukara, the product manager. Obleng, the product marketing. Editor of the product distribution.
Thank you.
Thank you very much, Carago team. I love the inclusivity angle. The fact that you considered the limitations we have in comms in Nigeria says a lot. Thank you for a great presentation. I would like to pass on to the judges. Mr. Namdi, Dr. May, you have the floor.
Hi, girls. Well done, well done. This is an amazing presentation, especially the idea. We've had a lot of discussion about healthcare, but what I love about this is the fact that you are going to issue of accessibility. What I would love you to think about is even when you apply AI in interaction with the application is to your education. How about language? Even that these people are people in rural areas, and we know that some people want to be able to speak English. So this is just one of the comments I have for this. But also, well done, girls.
We can't hear you, ma.
We can't hear you.
Can you hear me?
Dr. May, I think there's some echoing sounds in your background, so it's hard to hear you quite.
Is it better?
There's a lot of background noise.
Is this a better sound? Is this a better sound?
We not hear you, ma.
Is this a better sound?
We not hear what?
Oh yes, Dr. May, I think this is a bit better.
Is it better?
Yes, it is. Go ahead.
So I think everyone is here right now. Well done, girls. Everyone has done amazingly well. I want to say a big thank you to the ministry for creating this opportunity for young girls to showcase their talent. Honestly, I'm usually just blown away. This is our second round for this presentation that we've had in different schools today, the Southwest, and to be honest, I am blown away. I wish I had this opportunity when I was a girl myself. So I just want to say a big thank you to all the schools that participated, for most especially to all the members of the ministry, all the staff of the ministry who have worked tirelessly, day and night to put this together. I cannot thank you enough. But more than you cannot undermine the work of the teachers and the people behind the team who have supported these girls to get to this point. Honestly, I can't believe that such a novel idea and innovations can come from girls. So I say well done, well done, well done. Thank you so much. I love that I'm part of this, and it's wonderful. Thank you for educating me through.
Thank you, Dr. May. Mr. Namdi, you have the floor.
I would not like to repeat the same thing that Dr. May has said, but they really did have a great presentation. Well done to Carago, the Carago team in Ocean State. I really love the passion with which you use in presenting. I like how you put together your slides and the information that you put together. Well done. Once again, another great presentation.
Thank you, sir.
Thank you, sir.
Thank you, sir.
No. Thank you to all the teams and to the judges. We will take a 5 or 10-minute recess to allow the judges to review the information and to announce the results for us. So 10-minute recess for everyone. Thank you.
Thank you.
Thank you, ma'am. Announce the result.
Okay. Hello, Team Dynamos. I can see that you are trying to raise your hands. So let me unmute you. Unmute yourself, please. Hello, Team Dynamo.
Yeah, yeah, ma'am.
Okay, can't hear you.
If you want to ask, can show a video on how our product works.
Okay, you want to show a video of how your product works. Okay. I think the judges are ready and we're running out of time, but still we'll give you a few minutes to show your video. So please quickly show your video. Please share your screen. Team Dynamo, please share your screen. So we can't hear you and we can't see your screen. In this case, we'll just give the judges the opportunity to. Thank you. Thank you very much, Team Dynamo.
Dr. May, Mr. Namdi, I believe you're ready. You have the floor.
Yes, we are. I believe Dr. May would handle it. We're just wrapping up at the back end.
No problem. Take your time. Okay. Once more, I would like to thank all 6 teams. Team Dynamos from Ekiti, supported by Kim Plus Tech Hub, with your contribution to security, one button instant rescue with the Dynamos alert system. That was very good. Thank you very much. OHS Girls Techies, supported by 720 Degrees Innovation Hub with the THRAM Healthcare Technology. Thank you and well done. Vice Brigaders from Akure Ondo, supported by Growth Hub with EduHealth. Thank you very much for your presentation. Diverse Elites with the Scholars Hub app to connect learners and promote equity and sustainability in education, supported by Blockchain Innovation Hub. Team Mama 360 with the app geared towards solutions for maternal mortality, supported by Echo Innovation Center from Lagos. Carago team from Oshun, supported by Apollo Global Hub with the healthcare and social welfare app. Thank you very much to each and every one of the teams. You've all done wonderfully. And in a moment, our judges will let you know who's the winner.
Oh man, well done, girls. Like I said earlier, it's really difficult to choose a winner from, this amazing presentations we've listened to today. I want to first of all say that you all are winners. I can see each and every one of your ideas and innovation going places. So do not by any way see this result as a failure, but actually for you to be here today, selected, representing the Southwest, it's from a lot of schools that exist in the Southwest. you actually won. So, and just also know that it doesn't end here. So just quickly, because of time, we have all our winners, but this first, I will just focus on the first and the second. And it's actually between two teams.
What's shooting?
Sorry. Can you hear me?
Yes, we can, Dr. May. Go ahead.
Okay, sorry. I thought I'm the one to hear me. So it's between Diverse Elite and Team Mama 360. And the winner today is Team Mama 360. Well done. You are first, representing the Southwest. Well done, well done, well done, well done. Congratulations.
We would like to hear from you, Team Mama 360. Well done and congratulations. Team Mama 360, are you with us? Congratulations. Go ahead and speak, please.
Thank you for this opportunity. Thank you for selecting us. We are so excited.
You are most welcome. And thank you to you and each one of our teams and to the volunteer hubs that have supported this presentation. And thank you very much to the judges for participating and Ms. Mariam Lawan. We are all happy to have been a part of this. Congratulations to each and every one of you. As Dr. May said, you should all be very proud of your presentation and you should all be very proud of your ideas. Good luck moving forward. So I will pass on to Dr. Mariam for some closing remarks. Thank you and have a lovely day.
My God. Okay. So I just want to take a moment to recognize each and every one of you for your incredible efforts and your contributions. You are, whether you have emerged victorious in this competition or not, I want you to know that you are all champions in your own right, and your dedication, creativity, and passion have not gone unnoticed. And we celebrate each and every one of you. To those who have been crowned regional winners today, Team Mama 360, congratulations on this remarkable achievement. Your hard work and ingenuity have set you apart, and we commend you for your exceptional performance. We eagerly anticipate seeing you represent your region in the national competition. But to all the participants, I urge you not to let this moment pass in vain. Your innovation, your ideas, and your dreams deserve to be nurtured and pursued further. Do not allow your creativity to gather dust in the closet. Instead, continue to pursue your endeavor with unwavering determination and passion. Remember, innovation knows no bounds, and your potential is limitless. Whether you win or lose, what matters most is the journey you embark upon and the impact you make along the way. Once again, congratulations to you all, and I commend you for your outstanding efforts. Congratulations, Team Mama 360. Let us carry the spirit of innovation forward and continue to make difference in our communities and beyond. Thank you and best wishes. Thank you, judges. Thank you, volunteer hubs. Thank you to the school management, the teachers, and all the project team that have supported Nigerian girls in ICT competition. Thank you all. Have a good day.
Girls in ICT.
Yeah. Okay. Goodbye.